In this video, we will study about gestational diabetes mellitus. We will also discuss about causes, symptoms, risk factors, laboratory diagnosis, and prevention of gestational diabetes mellitus. Overview: gestational diabetes is a type of diabetes that develops in pregnancy when blood sugar levels get too high. Gestational diabetes usually appears during the middle of pregnancy, between 24 and 28 weeks. Developing gestational diabetes does not mean you already had diabetes before you got pregnant. The condition appears because of the pregnancy. What are the causes of gestational diabetes mellitus? Gestational diabetes comes from hormonal changes and the way our body converts food into energy. If you know, a hormone called insulin breaks down the glucose, sugar, from food and delivers it to our cells. Insulin keeps the level of glucose in our blood at a healthy level. But if insulin does not work right, or if does not have enough of it, sugars build up in the blood and leads to diabetes. During pregnancy, hormones can interfere with the way insulin works. It may not regulate your blood sugar levels like it is supposed to, which can lead to gestational diabetes. Genes and having overweight, a BMI greater than 25, may also play a role. What are the symptoms of gestational diabetes? Gestational diabetes does not usually cause any symptoms, but some people experience like frequent urination, nausea, thirst, and tiredness. Who is at risk for gestational diabetes? If you have a heart disease, if you have blood pressure, if you have inactivity, if you have obese person or any family history of gestational diabetes, if you have a polycystic ovary syndrome or any previous birth of a baby weighing about 9 pounds or more, pre-diabetes history of higher than normal blood glucose. This is the all factors can lead to the gestational diabetes. How does gestational diabetes affect any baby? If you have gestational diabetes, your baby more at risk for increased birth weight, weighing 9 pounds or more, breathing problems at birth, hypoglycemia. This can cause seizures in newborns, obesity in newborns, premature birth, type 2 diabetes later in life. How is gestational diabetes diagnosed? Your healthcare provider will test your blood sugar during pregnancy. The test may have two parts: glucose challenge test and glucose tolerance test. In this first part, glucose challenge test, you drink a sweet liquid. After about an hour, you will have a blood test to check your blood sugar level. If your blood sugar level is high, it can lead to glucose tolerance test. In glucose tolerance test, an oral glucose test is only done if your challenge test results are unusual. Your fast don't eat for 8 hours before the tolerance test. Your healthcare provider draws your blood before and 1, 2 and 3 hours intervals after you drink a sweet liquid. The tolerance test can confirm a diagnosis of gestational diabetes. How can gestational diabetes be prevented? It's not entirely preventable, but you can take steps to reduce your risk, such as eating a balanced diet and getting regular exercise before and during your pregnancy is the best way to reduce your risk of developing gestational diabetes.